All right, the major anatomical structures and coronary vessels of the heart. So we want to compare the superficial features of the anterior and posterior aspects of the heart, name the three layers of the heart wall and the tissue components of each, characterize the four chambers of the heart and their functions, and compare and contrast the structure and function of the two types of heart valves. We also want to describe the general structure of cardiac muscle, explain the intercellular structures of cardiac muscle, discuss how cardiac muscle meets its energy needs, and then describe the location and function of the fibrous skeleton in the heart. All right, so the superficial features of the heart. We're going to start off with our sulci. First, our external groove that marks the borders of the heart chambers. We have our coronary sulcus, and that's going to separate the atria from the ventricles. It's the groove that extends around the circumference of the heart. Then we have the interventricular sulci, which separates the left from the right ventricles. So of course, if we're thinking like here's our little heart, we're going to go ahead and show our coronary sulcus is going to go ahead around the circumference. And then, of course, we've got that interventricular sulci that's coming down in between the left and the right ventricles. So we have the anterior interventricular sulcus on the anterior side, right on the front, and then on the back side of this little heart that I drew here, you'll see the posterior interventricular sulcus. And it's going to extend from the coronary sulcus toward the heart apex and then back around. And the grooves are going to contain the coronary vessels supplying blood to the heart wall. So that's where we're going to find those coronary arteries that we saw when we dissected the pig heart. So the anterior view of the heart, you have the right atrium and the right ventricle are going to appear the most prominent. So the heart's almost kind of in this twisted shape here, so that what we see more of is going to be this side here of the right side and less of the left side. You also are going to have those little ears, right? The little flaps of the atrium that are called the right auricle, particularly this one. And then, of course, the left auricle will be on the other side. So we'll also be able to see the aorta and the pulmonary trunk. Those are going to be those guys that are sticking out here. And of course, we have the aorta back here. And then the small portion of the left auricle on the left atrium that we'd be able to see slightly here. And you'll also, of course, be able to see the anterior interventricular sulcus, which is part of the coronary sulcus. So here we can see, particularly in this image of the heart, just absolutely crazy how big the aorta is here, right? And then, of course, we can see the pulmonary trunk. We can see the right atrium right here and the right ventricle. You can, of course, see the coronary sulcus and then the interventricular sulcus here on the anterior side. And you can see just how it's turned more this direction to the right side versus being on the left. Okay, so on the back side of the posterior view, we're going to see more, of course, of the left atrium and the left ventricle, and it's going to show that posterior superior surface. You're going to see more of the left atrium there. You'll also be able to see the pulmonary veins that are attached to the left atrium. You'll have the superior and inferior vena cava coming into the right atrium along with your pulmonary arteries, and then the posterior interventricular sulcus separating the left and the right side of the ventricles, and then part of the coronary sulcus that's going to be housing the coronary sinus, where all of the deoxygenated blood from the heart muscle is going to be coming back into the right atrium to go ahead and go through the pulmonary circuit to receive oxygen. So again, here's that back side, right? You can see this is kind of like the bottom part of the heart here, and we can see the inferior vena cava right here. We can also see those right pulmonary arteries and the left pulmonary arteries, of course, the aorta coming right here. And of course, just noticing how much more of the left side that we're seeing in comparison to the other side. Okay, so a quick clinical view, talking about teenage athletes and sudden cardiac death. So sudden death can be caused just because of undetected cardiovascular diseases that someone might have. A lot of times they're going to be congenital heart defects, just meaning that they've been there since birth. And they could also be coronary artery anomalies. So remember that our heart has its own blood supply, and you can have issues or anomalies within those arteries. So this can result in what's called a cardiomegaly, and it's the increased thickness of heart, means that you might have swelling, dizziness, arrhythmia. So the rhythm of your heart would be off. You might have shortness of breath, and you can go ahead and see it by an x-ray, and then it's going to be confirmed by an echocardiogram. Some other things that we see with the heart is heart sounds and heart murmurs. So there's 4 normal heart sounds. The ones that we think of are going to be the lub, dup, or S1 and S2. So S1 is the closing of the AV valves in between the atria and the ventricles. And then the next one, the S2, is going to be the semilunar valves closing when they're going through the aorta and the pulmonary trunk. And then you have the 2 minor sounds, S3 and S4, are going to be more particularly useful in the clinical setting. So each valve can be heard best at specific anatomic locations. If you have a heart murmur, there's going to be an abnormal heart sound. So it's the result of turbulence of blood passing through the heart. So some of the murmurs are going to be medically important, some are not, but there are 2 major types. There's the valvular insufficiency and then the valvular stenosis. So when we talk about these 2 different types, that first one here, the valvular insufficiency, we see that those cardiac valves are just leaking because the cusps of those valves are not closing tightly enough. So it means that we're going to have blood that's regurgitating back through the valve. So you're going to have, instead of a unidirectional movement of blood, you're going to have blood moving back. And it can cause heart enlargement, right? Because you're not actually expelling all the blood. The next one is the valvular stenosis, and this is where those cusps are scarred and they cannot open completely. So they just never are allowing full movement of the blood. And so this is going to cause resistance, and it's going to reduce the amount of output that the chambers can go ahead and have. And so you might have your chambers actually enlarge and dilate, which is just enlarging as well. Okay, so talking about the layers of our heart, the heart wall varies in thickness. If you remember from the pig heart dissection, you could tell that the 2 ventricles were very different in the thickness of them. And also the atria are going to have thinner walls than our ventricles because they're just not pumping as much blood to bigger areas, right? So the left ventricle in particular is going to have a thicker wall just because it needs to be able to generate a high amount of pressure to force the blood through the systemic circulation, whereas the right is just pumping to the lungs, right? So it's just going to the lungs. So there's 3 layers for the heart. There's the epicardium, that's our first one on the outside, the myocardium in the middle, and then the endocardium that's on the inside right next to the blood. So the epicardium is the visceral layer of the serous pericardium, and it's the outermost layer, and it's made of simple squamous epithelial tissue and areolar connective tissue. This may be reminiscent of the pericardium that we talked about last time. Our myocardium specifically, of course, myo is going to be for muscle. This is going to be our thickest layer, and it is just cardiac muscle tissue, right? So it's just from pumping blood, and that's the only place that we're going to find cardiac muscle tissue. The endocardium, that of course endo meaning inside, is going to be the internal surface of the heart, and then the external surface of the valves there. And it's simple squamous epithelial tissue and areolar connective tissue, and it's continuous with the lining of blood vessels. All right, so some chambers that we find in the heart. So there's the separation of the chambers, so how they're actually separated from each other. We have the interatrial septum, which is going to separate the left atrium from the right atrium. So that's going to be this section, you know, going up and down in between them. And then we have the interventricular septum, which is going to be separating the left and the right ventricle, which honestly, if we look at it, it's just around that same place of the coronary sulcus that we find there on the anterior and posterior side of the heart. Then our right atrium, talking a little bit about that, we have these muscles called the pectinate muscles, which are ridges on the anterior wall and within the auricle, those little ear flaps of the atria. Also in the right atrium, we find the fossa ovalis, which is an oval depression on the interatrial septum, what we just talked about here that separates the left and right sides. This is where we're going to find the fetal foramen ovale, which is a hole that has blood being shunted from the right to the left atrium in fetal life, just because we don't actually breathe in our mother's womb, so we don't need to have the right ventricle pumping blood into our pulmonary system. That's unnecessary. We just need it to go right into the left side and then to the rest of the body because we're getting oxygen from our mother. Entrances from the coronary sinus which is going to be carrying blood from the heart wall. So all of that deoxygenated blood from the heart muscle is going to be coming into the right atrium along with the superior vena cava, and the inferior vena cava bringing in deoxygenated blood from the systemic circulation from the entire body. It's going to go ahead and exit into the right ventricle through that right AV valve, or the tricuspid valve as we're used to calling it. Talking about the right ventricle, we have first the trabeculae carnae, which is the irregular muscular ridges inside the ventricle wall. So when you opened the heart up, you should have easily seen all those ridges. Then, of course, the papillary muscles, you can see those as well. They look similar to muscles, but they have much more of that papillae shape, that cone-shaped projection. And they're also connected to the chordae tendineae. Now, the chordae tendineae, remember, they're just the heart strings that connect to the AV valve into that tricuspid valve. And they're just strands of collagen fibers, very strong, even if they are very thin. But they allow for those valves not to, be flapping in the blood per se. And then the superior exit of the right ventricle, so at the top right, is going to be into the pulmonary trunk right here, and then into the pulmonary semilunar valve, and then on into the pulmonary system. All right, so the left atrium also is going to have pectinate muscles in its auricle. It's going to have the pulmonary veins entering into that left side, and it's going to exit into the left ventricle through the left AV valve, also known as our bicuspid or our mitral valve. And then our left ventricle, again, is going to have the trabeculae carnae on the internal wall surface, so just those ridges. Also is going to have the papillary muscles that are anchoring the chordae tendineae from the bicuspid or mitral valve. And then at the very top of the left ventricle, you're going to find the exit of the aorta, and the blood would go through the aortic semilunar valve into the aorta and out to the rest of the body. All right, so talking about the heart valves. So the valves basically just ensure that the blood is moving in one direction and one direction only. So it's always going to be going in this direction, right? So it's always going to be circular instead of going counterclockwise. The valves are made of endothelium-lined fibrous connective tissue cusps, and so they're just these little flaps. And if you remember, they're pretty thin when you played with them on the heart, but also fairly strong as well. So the atrioventricular valves are going to prevent backflow into the atria. But when they're open, the cusps extend into the ventricles, so they're going to be going out like this, and so then blood's going to be coming this way, right? And then they're going to close because the ventricle is going to squeeze here, and it's going to cause these guys to go ahead and close up, because the ventricle is going to contract and that blood's going to move upwards, and it's just going to close those flaps, or the valve. So there's one valve in each atrioventricular opening. Of course, we just talked about that being the tricuspid, the right AV valve, and then the left AV valve is going to be the bicuspid or the mitral valve with its two flaps. So we can see those here, right? There's our right atrioventricular valve with the three flaps making it the tricuspid, and then on this side we're going to have our bicuspid with two flaps there. And then, of course, we can just kind of see that blood flow as it comes through. When the valves close, it's going to push, just think of like a parachute air, or the blood going ahead and pushing it up so that it closes. And then the semilunar valve, of course, is going to open as it rushes here. And then it automatically, once we have blood flow in here, that blood flow is actually going to push the semilunar valves closed, as what we're seeing right here, into the aorta and the pulmonary trunk. So the semilunar valves are going to prevent backflow again, to ensure that we continue that one unidirectional flow of blood. They're open when the ventricles are contracting because of the way that they're set up, right? They're set up like this so that when the ventricle contracts, that blood can just go ahead and push those doors open, but they're going to stay closed when the blood tries to get back this direction. The arterial pressure is going to become greater than the ventricular pressure. So that's why that greater pressure in here is going to go ahead and ensure that those close, so that the blood doesn't slip backwards. And each of the two semilunar valves is going to have three cusps. And the pulmonary semilunar valve is between the right ventricle and the pulmonary trunk. And then the aortic semilunar valve is between the left ventricle and the aorta. So kind of nice because they're, named according to the vessel that they're connected to, the greater vessel. All right, I'm going to take a break here and we'll start another video. So come back for the structure of cardiac muscle.